Good evening, everyone. Were you all just relaxing, feeling like you were at a spa, just like I was with that great music? I know I was. But as I need to move on, I want to say good evening again to everyone that has joined us, and I want to welcome you to the third Women She Served Women Veterans Virtual Summit. This evening is going to be about having a powerful and dedicated time space to honoring, uplifting, and activating the voices and experience of women veterans. My name is Kendra Hall. I'm your moderator for this evening, and it is my absolute honor to guide you through this summit. I'm a nurse practitioner, and I'm also the deputy manager of the Women Veterans Program at the Hampton VA. And like many of you, I'm walking the walk of service, leadership, and impact. Today is about you, your journey, and the future we're building together. Before we jump into the good stuff, let's take care of a few quick housekeeping notes to keep this space smooth and focused. The purpose of this event is to have a platform to address health concerns specific to women veterans. We do want to hear from you, but we're going to ask that you please mute your microphone during the program. Also, please hold your questions at the end of the program. There will be an allotted time for you to ask your questions. We will either call on you, or if you are more comfortable, you're able to put your questions into the chat box. Now, because I am a taskmaster and I need to keep this ship on course, even though don't ask me the proper name for the front or the back of a ship, because that's not about me. This is about, me being steering this ship and keeping it on task. So I had this little assistive finger here. If at any time during the question and answer session, it may be getting a little too long, you may hear me tap 3 times, because you're going to hear some phenomenal information from our subject matter experts. However, they are providers and they do need to work tomorrow and see patients. So we want to be respectful of their time and get them on and about their merry little way. So once again, we want to hear from you, but we also want to be respectful of each individual's time. So just those little housekeeping things. And like I said, if I make a mistake, no, I didn't make a mistake, because I don't make mistakes, right? So we're going to go ahead and get started. This is going to be the only time that you see me on camera. From this point forward, you will only hear from me. And I know you probably think, thank God, we don't want to see you anyway, Miss Lady. However, again, thank you for joining us this evening. And I am going to now turn my camera off, and then I'm going to introduce you to our first guest. So first, our first guest is going to be Dottie Ballou. She's a dedicated health system specialist and executive assistant to the chief nursing officer for the Mid-Atlantic Healthcare Network, where she has served since 2018. In this role, she provides expert executive, operational, and analytic support across a rapidly growing, complex network serving more than 509,000 veterans. She holds a Bachelor of Science in Nursing and a Master of Science in Health Services, Healthcare Management, and maintains multiple certifications, including Certified Professional in Healthcare Quality, Healthcare Analytics Certification, VHA Certified Fellow Mentor, and Federal Acquisition Certification Core Level 1. Dottie is passionate about strengthening healthcare systems, supporting leaders and teams, and improving processes that ultimately enhance the veteran experience. She excels at bringing people together, simplifying complex issues, and ensuring that decisions are supported by accurate data and thoughtful analysis. Please join me in welcoming Dottie Ballou.
Good evening. It is truly my pleasure to welcome you to this year's Virtual Women's Veterans Summit. I not only have the privilege of serving you as a health system specialist for VISN 6, but I also stand here proudly as a woman veteran myself. So within our network, we are honored to serve a remarkable community, more than 510,000 enrolled women veterans, and over 76,000 of us have entrusted our care with VISN 6 alone. And that trust means everything to us, and it drives our commitment to strengthen and expand the services you deserve. Since 2025, our network has opened 4 new clinics, 2 in North Carolina and 2 in Virginia, each designed with the goal of increasing access, reducing travel burdens, and enhancing the quality of care for you, our growing women veteran population. And these expansions represent more than buildings. They represent our commitment to meet you where you are, to listen, and to invest in your health and well-being. This year's summit focuses on topics that are deeply important to the women veteran community: mental health services, military sexual trauma, and pelvic floor rehabilitation. These are not easy topics, but they are essential ones. They reflect real experiences, real needs, and real opportunities for us to make a difference. Today's sessions aim to inform, empower, and connect you with experts, resources, and support networks. But more importantly, they remind us that your voice, your story, and your health matter. Thank you for joining, for engaging with these important conversations, and for allowing our network to continue serving you. I am honored to walk alongside you and be a part of your current and future care. Welcome to the 2026 Women Veterans Summit. We are truly glad you're here. Thank you.
Thank you so much, Miss Belil, for that. And now, ladies and gentlemen, if we have, well, we do actually have one gentleman here, but if we have any others that may have cared to join, then welcome again. But I want to introduce our next speaker. And she's not really a speaker on topic, but she is someone that you certainly need to know. And that is going to be our esteemed leader, per se, and that is Miss Shanika Williams Johnson. She is the lead Women Veterans Program Manager with the Department of Veteran Affairs Mid-Atlantic Healthcare Network. In this key role, she is responsible for improving access to care and continuity of care and supporting change to promote safe and welcoming environments for 80,000 plus women veterans. While in her role, she had oversight of the construction and implementation of a mobile mammography unit to support Greenville and Wilmington healthcare centers and numerous other projects to promote the privacy, security, dignity, for women veterans. She also serves as a point of contact to the medical centers regarding post 9/11 military to VA case management program. Shanika proudly served our nation in the United States Navy Nurse Corps for 13 years and was honorably discharged at the rank of Lieutenant Commander. Please join me in welcoming Shanika Williams Johnson.
Thank you, Kendi, and good evening, Army, Navy, Air Force, Coast Guard, Marines, and Space Force veterans, and all of our supporters. It truly is an honor and a privilege to come to you this evening to share some of the great resources and services and care that's provided across North Carolina and Virginia to our women veterans. When I started this role, I I was kind of hesitant a little bit, but because as a woman veteran, sometimes you may experience it, you may have negative experience or so experience or great experiences, and when I got into the role, and particularly when I first started working for the VA. When I got off of active duty, my perception of VA care was not the greatest because I listened to everyone else in the community that talked about the VA. But when I started working for the VA, I was wowed and blown away that, wow, this is the type of care that women veterans received within this organization. And then when I started this position, I really made an effort to let others know that this is not your father's, grandfather's, great-great-grandfather's, and uncle's VA of past, that things really have changed in it. And I hope today that there's something that our participants learn and can share with other women who may have had a negative experience in the past with the VA, but give us another try, because truly the VA has absolutely changed for the better. And when I started this role 16 years ago, we had less than 25,000 women veterans across North Carolina and Virginia. And as you see by this graph, we have a little over 90,000 women, and that is phenomenal growth in that period of time. And I tell you, that's not the only thing that has grown. With the number of women that has increased, so has the type of services, initiatives, and care that we provide to our women across the VISN 6 catchment area. And that care and growth did not occur in a vacuum, and it is primarily due to the phenomenal, strong women's health leadership teams at each of your facilities, and the support of the executive leadership teams at each of our 7 facilities across VISN 6, because it absolutely does not happen in a vacuum. And right now, I'm going to introduce to you some of those great team members, the women's health team members in our network. Next slide, please. First, I want to introduce Asheville's. Asheville Healthcare Center is led. The medical center director is Dr. Human. Each and every facility has a women's health medical director and a women veterans program manager, and they are truly your advocates. They're go-tos for and leaders for women's health care at the facility. And Kim McDowell is the women veterans program manager, who is also a Navy veteran. Next, we have Durham Healthcare System, and led by Dr. Elizabeth Batara, who is the Women's Health Medical Director, and Jamie Upchurch is their Women Veterans Program Manager. And Durham has support for the Women's Health Program, even at the HCC. Brenda Roberson is the Deputy Women Veterans Program Manager, who is located at the Greenville HCC. So it's great to have that presence with not only at the medical center proper, but at other locations as well. So at Fayetteville VA Medical Center, a coastal healthcare system, Dr. Prashanti Pila is the Women's Health Medical Director, and she's also a gynecologist. And her deputy medical director is Miss Lynn Carlton, who is a certified nurse midwife and also a retired veteran of commander of the Navy Nurse Corps. And Miss Carrie Enright is the Women's Veterans Program Manager at their location. And Lynn is physically located at Jacksonville, in the Jacksonville CBOC area. So again, so is Carrie. So it's great to have presence of the Women's Health Program across that enterprise. Next is Hampton. So at Hampton VA, Dr. Trish Tran is the Women's Health Medical Director, but we also have retired Navy Commander Catherine McDonald, who is the Women's Health Medical Director, the Women Veterans Program Manager, and Candy Hall, also our moderator for this evening, is her deputy. Now, you all may feel that it's some type of conspiracy going on, that VISN 6 only hires veterans from the finest branch of the military, the Navy. Well, that's not true. We do allow some Army and other folks to come in to lead the Women's Health Program, as evidenced by Marlise Skinner. Marlise is the Women Veterans Program Manager at Richmond, and she is an Army veteran. And she leads the program with her new deputy, who is Miss Chiquita Wright, and she recently joined the Women's Health team. And so very, very excited to see that leadership team come together there at Central Virginia or Richmond, and excuse me. And And next is Salem. So at Salem Medical Center, the Women Veterans Program Manager is Miss Melissa Miles, and Dr. Marie Lavoie is the medical director, and she's also a gynecologist. And our final facility, wrapping it up, is Salisbury. So Salisbury has an interim medical director, Dr. Pretty Bagia, and Dr. Bagia is also new to the team, and very excited that she has joined as the interim with Miss Melissa Gilmore, who's the interim Women Veterans Program Manager, and that team is anchored by Jessica Barnett, who is the Women's Health Support Assistant for the program. Now, we take mental health very seriously, as you will hear other information regarding the mental health care services that we provide to our women veterans. And so if you do see someone that is struggling with suicidal thoughts, there is the suicide crisis line, well, the Veterans Crisis Line, 988 and down one. But having that safety plan is extremely important. Of course, connecting, helping to connect that person with mental health services and treatment, getting them in touch with the VA is extremely important. And we just want to stress that message that you do not have to struggle alone, that the VA is here for you. Next is, I really like this link, and I think Dr. Karen is going to speak more about this, which is make the connection. And on this link, you're able to hear other stories from other women and may connect, and some of the stories may resonate with you. So Making Connection is about real veterans, real stories, and it's a podcast found on this link. And so the stories are extremely inspiring. I was listening to some the other day. So each participant here will receive a copy of this PowerPoint presentation. So you will have these resources to refer to later. And the Office of Women's Health has a Women Veterans Call Center. And this call center allows women to either have a phone conversation or chat or text. So you can get your questions answered regarding various healthcare options or healthcare services, I should say, and understanding some of the care that you deserve via eligibility, because they will connect you to your local VA in order to get some questions answered and for that next follow-on step. And finally is our VISN has a clinical contact center, and this is this clinical contact center can allow you to avoid unnecessary clinic visits and actually receive healthcare in the comfort of your home. So there's timely virtual care, and there's a nurse that's able to triage you for your symptoms and ensuring that you receive any medical advice without any delays. So this really is a wonderful resource to have and to use, and I encourage everyone to absolutely reach out to the clinical contact center as needed. So you can select one for pharmacy, 2 if you need to schedule an appointment, or 3 to speak to a nurse. And now I will turn this back over to our awesome moderator, Candy. And thank you again for your time and attention.
Thank you so much, Shanika. All righty, let's get this ship to sailing. Remember, y'all not asking me about what's the front and what's the back of a ship called. Okay. Our first speaker is going to be Dr. Kelly Karen. She is a PhD and a clinical psychologist within the Durham VA healthcare system and the director for women's mental health. She leads the women's mental health what we refer to as the BHIP team, and serve as the women's mental health champion. She provides clinical care with an emphasis on provision of tailored, gender-sensitive, and trauma-informed care. She provides supervision and training within the Durham VA Psychology Internship Fellowship Programs. Please join me in welcoming to the stage Dr. Kelly Karen.
Thank you. Thank you so much for having me. I'm going to warn you in advance that my internet connection is not going great. So if you have any issues with my technology, just let me know in the chat. Let's go to the next slide. Okay, so these are some of the things that I'm going to talk to you about in my small amount of time that I have. I'll go over an overview of how women veteran mental health is unique based on the experiences of women and women veterans. And I'll generally, for the rest of my time, will just try to orient you to what outpatient mental health services is like, how to access it, and how to make sure that you're getting the best care possible. Next slide. So I have a few slides here that kind of outline different areas of life for women and women veterans and the ways in which their experiences lend to unique needs with respect to mental health care. The reason why I have this information here is essentially to validate that your experiences as women veterans are unique and different from male counterparts, and that the care that you require as women veterans within mental health is also unique. Within mental health services at your local site and nationally within VA, there's a lot of effort put into training mental health providers to understand the unique needs of women veterans. And there are some of us out here that make it our regular gig to work with women veterans and understand these unique needs. There are some things here relating to women's uniquely sort of disproportionate exposure to trauma experiences. And obviously, there are a number of things listed here relating to women's unique needs that overlap with biology and their medical needs, including ways in which women experience unique barriers to care, including their medical and mental health needs being more likely minimized and invalidated by the healthcare system and society at large. Next slide. Military experiences for women veterans, of course, can be quite unique. They are disproportionately likely to experience military sexual trauma, and the institution itself isn't necessarily built for women. So women will report that more likely they have difficulty accessing support and resources, and feeling like the institution itself wasn't really built for them. This can lead to unique mental health needs following military service. Overall, women experience certain stressors much more than male counterparts, and this then impacts their mental health and well-being. These are things that are really important for us to understand as mental health providers. And of course, I want to sort of validate for all of you listening that these are important factors to your mental health, and understanding these as your providers helps us to tailor and individualize your care. We do not want to give the same care to all veterans. We want to give individualized, unique care plans to women based on what they need and what they've experienced. Next slide. Okay, so I'm going to talk a little bit about what might go on in outpatient mental health services. As the introduction went, I am at Durham, and so I'm going to speak about Durham's services. This is relatively similar to what is available at different sites, but depending on which hospital system you're in, whether you're at a main hospital or a CBOC or an HCC, your services will vary. So it's definitely important for you to get to know your local services. But this can include, mental health services can include psychotherapy, which might include group psychotherapy, individual, couples, and even family services. Psychiatric med management services, care coordination, which is a little bit like having a sort of point person for your mental health care, peer support, occupational therapy, chaplain services, and more. And the idea is that all these folks are kind of working together to best understand how to deliver care for you and offer multiple points of intervention for the things that you need for mental health care. Next slide. So outpatient mental health care is generally made up of general mental health teams and specialty mental health teams. In my introduction, BHIP teams were mentioned. I'm going to try to explain what that is. So a BHIP team is a behavioral health interdisciplinary program. That is a lot of words. This is essentially a general mental health team that has a lot of different people working in it to kind of give lots of different perspectives on mental health to provide the best care possible. This serves as like a mental health home for veterans that are assigned to that team. And they provide a wide range of services, and I'll say more about that in a slide later. There are also, though, these specialty teams that do more narrow work on an area of special focus. So we have trauma recovery teams and health psychology teams and substance use disorder teams. And these teams have providers with specialty training. And once you're on a BHIP team and they determine that you could benefit from a specialty service, they'll refer you out to those specialty teams. And then you come back to that BHIP team. A BHIP team itself is going to be made up, when it's fully staffed, will be made up of about 8 to 9 staff members serving up to 1,000 patients. And like I said, there's a wide range of providers that can work on those teams. Some facilities, like our facility at Durham and Hampton, and there might be more, have women's health BHIP teams. We have 2 at Durham, and I think Hampton might have 3. I think I heard this recently. So some facilities will have women's health BHIP teams that exclusively serve women veterans. But it's really important to know that all BHIP teams welcome women veterans, and some of the other sort of general population BHIP teams have women's mental health champions or other providers who have a specific interest in delivering women's health care. So you don't need to be on a women's health BHIP team, but we sure do like what we do. Next slide. Here's quite a long list of the things that we can address in a BHIP team. These are things that are relevant to our specific BHIP team. You know, depending on who is there, who is working in that BHIP team and what their areas of specialty are, this will vary a little bit. But it's really important for you to see here. What I want you to take away from this is they're doing a wide variety of things. And it's also important to know that we're not restricted in delivering care that is specific to military service that started or is a result of things that happened during military service. We help folks with symptoms related to childhood trauma or with symptoms related to interpersonal violence that occurred after the military. So whatever it is that you're experiencing, whenever it started for you, feel free to come on down and ask for some assistance from your mental health team. Next slide. There are 2 main ways for you to access care. First way, if you're not already engaged in mental health care, is to talk to your PAC team. That's your primary care team. Let them know that you're interested in care. I strongly encourage you to say a little bit about why. And the reason for that is because of what I mentioned about how sometimes services will vary a little bit from BHIP team to BHIP team, and getting to know a little bit from you, best as you can describe what you're looking for. This might include like, I'm looking for definitely therapy, I don't want meds, or I'm open to therapy or medications, or I just want group therapy. And I would like this in relation to whatever symptoms you're experiencing or goals that you have. I would like to treat symptoms of PTSD or depression or address my sleep. So give some of that information to your primary care team in a visit, a secure message, a phone call, and they'll get a consult rolling for you. If you're already engaged in mental health care, though, you're strongly encouraged to speak to your current providers with to let them know if you'd like something additional or you have some need for a change. Next slide. Okay. I'm fairly certain I'm behind schedule, so I'm going to try to move as quickly as I can. Okay, So a little bit here about best practices. What I really would like for folks to take away from this is just to have a little bit of information about how we try to formulate a care plan that is backed up by science at the same time that it's individualized for you and meets your needs. Okay. Professionals in mental health have to follow clinical practice guidelines, and particularly their ethical guidelines associated with their license. The VA also has clinical practice guidelines. I have some links here that I hope you can access that give information about, hey, what does the research literature say is clinically indicated or best practice for depression or PTSD or other things. So we try to follow those best practice guidelines as much as possible to make sure that we're delivering the highest quality care that we can. Oftentimes, there are multiple options to move through so that we can pick things that match the patient best, or that they have backup options if they've tried one already. Next slide. Okay, so how do you know? I don't read this research literature. This isn't my degree. How do I know if I'm getting good care? I really want to empower and encourage you all to be really active consumers in your mental health care. Here are some tips, some questions to ask or conversations to have with your providers to ensure that you're getting the best care possible. It's really important that you know what your goals are for mental health care and to be as specific as possible about that when you're talking with your providers. Goals not only give you something to work towards, but they also give your provider something to measure in terms of how well treatment's working for you. So if you really want to get out of bed, you've been in bed a whole bunch and you want to get out of bed 6 days out of 7, that's something that can be measured. And if you're still staying in bed at the end of this treatment, then the treatment isn't helping you the way that we want, and we need to make a change. So it's really important for you to know what your goals are and talk to your providers about that. Talk to your providers about how your treatment plan will match up to your goals and whether or not those treatment components are evidence-based. You can ask directly, is this medication evidence-based to treat depression? Or is this group therapy that you're referring to going to help me get out of bed more days in the week? You can ask your providers how they're going to measure your progress or how well the treatment is working, and regularly check in with them about how they think treatment is going. And you ought to let them know what you think about how treatment's going. In the next slide, I have a list here. I'm going to have you just as a reference that you can read through. This is, honestly, this is sort of straight from my heart. This isn't like a policy or anything like that. These are just things that I like to remind my patients and folks that I talk to about what your rights are. I want to really encourage you to be an active participant in your care and communicate directly, clearly, of course, respectfully, with your providers about what you need and how it's going for you. Next slide. These are some resources. Make the Connection is on there, actually. These are some resources, some links for you to take a look at. Not necessarily going to go through these in any detail, but just some other things for you to kind of click through and check out. That last bullet point on there is also just a reminder that mental health is not necessarily something that is only impacted or benefited by mental health treatment delivered by mental health providers. So our partners in whole health, recreation therapy, chaplain services, and other departments, really the work that they're doing really helps our patients' mental health recovery as well. And so we really encourage folks to think really broadly about what will benefit them and their mental health and their well-being. So I'll close there and stick around for Q&A later. Thank you.
Thank you, Dr. Karen, for that very, very informative presentation. Now I'm going to introduce our next subject matter expert, and she's going to be speaking on the topic of military sexual trauma. Now, with this topic, please remember that to take care of yourself. So if you find something to be a little bit triggering, please take a deep breath, walk away, and come back. In the interim, allow me to introduce Miss Marie Stewart. She is a licensed clinical social worker who serves as the military sexual trauma coordinator and as an outpatient therapist on the women's health, mental health team at the Durham VA Medical Center in Durham, North Carolina. Marie has practiced as a social worker over the past 30 years and as a licensed clinical social worker for the past 20 years. She joined the Durham VA healthcare system in 2008, beginning her VA career as a PTSD substance use disorder clinician. Marie then transitioned to work as an outpatient therapist with veterans in the PTSD clinic, as well as with survivors of military sexual trauma. Marie was selected for the role of Military Sexual Trauma Coordinator in 2013. She is certified in multiple evidence-based treatments such as cognitive processing therapy and prolonged exposure therapy. She also provides consultation and training to staff on effective ways to provide trauma-informed care for survivors of military sexual trauma. She believes in providing strength-based, client-centered, trauma-informed care in collaboration with the patient. She also believes in coordinating care with treatment team members. Please join me in welcoming Miss Marie Stewart.
Thank you so much for having me here today. And um, thank you for allowing me to follow Dr. Karen. We work very closely together, and I have the honor of working on that treatment team with her. And so today I am going to be talking about MST, which is a sensitive topic. So please, as has already been introduced, to take care of yourself. And so what is military sexual trauma? MST is the term that's used by the VA to refer to experiences of sexual assault or threatening sexual harassment that occurred during a period of military service. And so, we really care as a healthcare system a lot to provide care for women who've had this experience. It can occur on or off base while an individual was on or off duty. And the perpetrator may have been a service member, it could have been a civilian, it could have also been an intimate partner that also is also included as part of the definition. A lot of times, sometimes people don't think about that as being part of someone that as an experience that could have counted. But as long as there was a lack of consent and the abuse occurred during a period of service, it does also count as MST. And the reason for the assault or the harassment does not matter. It also can include incidents of hazing. Next slide, please. One thing I do like to always include is that MST or military sexual trauma is not a diagnosis. It is an experience. And unfortunately, we have many women who've had this experience or reported that 1 in 3 women have said yes to their healthcare provider. They have had either harassment or assault. Veterans from all backgrounds have reported experiencing MST. That's regardless of era of service, that's regardless of race or gender, regardless of rank in service, and also branch of service. Next slide. We do know that MST really can affect both your mental and physical health. And so these are just some of the common reported symptoms or experiences that women have identified and come forward that's brought them into care. Some of these Dr. Karen's already talked about, but we really have a lot of women that describe, like after having this experience, a lot of really strong emotions. They may be impacted by having a lot of difficulty with their family in our relationship problems. They may find it getting close, may have a difficult time building their relationships or getting close to loved ones, or feeling like the opposite of that, that they feel very distant or avoidant or isolating. Sometimes as a result of this experience, and women can also identify having difficulty with body image, either engaging in overeating or not having appetite at all. They may have difficulties trusting with others and also have difficulty with expressing their emotions and communicating. They may have pain or physical problems. This experience can impact how you feel about yourself and how you view the world, and therefore can impact how you feel, your emotions related to how you feel about yourself as far as self-esteem. There may also be, because MST is of a sexual nature, you may avoid intimacy or have a lot of concerns about engaging in intimacy. Um, and so sometimes additional help may be needed related to that. These issues can also lead to work or problems in school, again, avoidance or isolation. And it is very common that some women will report using alcohol or drugs to try to help to manage some of these emotions as they show up. Next slide. And so, what steps can you do to ask for help? What we know, which is a little bit unique than other mental health and also other experiences, is that the VA offers free MST-related services for veterans who've had this experience. We also have some cases where, even though you may not have served for full 2 years, you may be eligible to receive MST-related services if you're not eligible for other VA care. And one thing that's really important to know is that there's also no documentation of the MST experience that is needed in order to get care. Sometimes people feel like they need a prior diagnosis, or they need to have reported this to someone else before they come in. And absolutely, for many providers or many veterans that come forward, sometimes talking to a VA healthcare provider may have been the first time they've ever reported it. And so every VA has what's called an MST coordinator. And our job is we provide education to healthcare providers, but we also can provide education to you about how to access services and to provide resources. And at the end of this presentation, I will have a list of who the point of contacts are throughout the VISN, that if you have any questions, that you can link with an MST coordinator that can give you more information. And as the box on the side says, we really do, as providers, believe that it's never too late to take the next steps towards healing. And we believe you and we believe in you. Next slide, please. And so we firmly believe that recovery is possible. And so the VA offers all levels of evidence-based treatment for survivors of MST. Dr. Karen has talked about some of those that are available at Durham, but also throughout the healthcare system. And so these treatments are really available in both individual and group settings. I did not go into a lot of detail about some of these because it really may vary according to where you're located. There are some hospitals that actually have separate MST like teams. And then we have some healthcare systems that the providers that you may get assigned to, they're integrated into the teams that Dr. Karen talked about earlier, which are BHIP teams. What we do know is that many of our providers are really trained to provide specialized care to veterans who've had this experience. The VA also has residential treatment options available. And so, depending on the evaluation that you may experience with a licensed clinical social worker, a clinical psychologist, they can help to determine what the best level of care is in order for you to meet your needs and reach your goals. And so your provider can also refer you to engage in what we call collaborative care to assess you in reaching your goals. And so to backtrack, some of the treatments that are available that you may hear, depending on if you're diagnosed with depression or anxiety, or you may have issues related to sleep, you may be referred to an educational group to learn more about what your symptoms are related to these traumatic experiences. You may be referred to or be offered a choice to participate in skills-based groups to teach you skills on how to manage strong emotions associated with this experience. Or you may be referred to evidence-based treatment that allows you to target the specific symptoms, trauma-related symptoms that are associated with this experience. And Dr. Karen talked about some of those. Some words or treatments you might hear may be cognitive processing therapy, prolonged exposure therapy, EMDR, and there are other treatments that are also available in both individual or group settings. Next slide, please. So what I've included here is a list of resources, and these are resources and links to that are available for veterans and your family members. We know that this experience can impact how people feel about just trusting with even our healthcare system. And so it's really important that uh, that you know that we are a trusted place, we are a trusted institution, and that these are informational resources that you can get your feet wet to learn more about what is available. And maybe you may feel comfortable reading this first before you decide that you want to engage in treatment. Some of these have already been discussed, but they are more like MST related. So the first one is a link that is specifically designed for survivors that you can learn about what are some of the key resources related to MST. We've already talked about face, which really allows you to hear from MST survivors about their stories of recovery. And so some of the treatments that I mentioned earlier, you can hear people talk about their experience of participating in CPT or participating in PE or participating in some of the other like skills-based groups. I'm going to talk separately about the Beyond MST app, the next slide, but there are brochures that are also available. And there's also at the bottom of that last page, there's a really nice handout on how to also manage discussions about trauma in the media. There's a lot of discussions about that right now. And so sometimes that can feel overwhelming. And so those handouts, some of them are listed there, may help you to have at least some coping skills that you can review and read. The VA has developed an app that's called the Beyond MST mobile app. And this is a free and secure private mobile app for veterans who've experienced MST. It has like over 30 specialized tools and other features to help survivors cope with challenges and manage symptoms and improve that can hopefully help you move towards a quality of life and to also help you to find hope. One thing I did not mention is that as you're talking with either your primary care provider or if you get connected with a mental health provider, you can request the gender of the provider if it is available that you prefer to speak with. Sometimes you may feel uncomfortable talking to a male provider, or it may feel more comfortable speaking to a female provider. These are things that you can request, and that the VA will work their best to try to meet your needs. Next slide. And so listed over the next 2 pages are the points of contact for who the MST coordinators are at each of the facilities. There's one in Asheville, Durham, Fayetteville, Hampton. Next slide. There are 2 affiliated in the VAs in Virginia. There's one for Richmond. There's one for Fredericksburg. We also have one for Salem and also for Salisbury. And so if you ever have any questions and need additional information on how to access care or how to even develop your treatment plan, please feel free to reach out to these points of contacts and they can give you more guidance. I will always encourage people to, if you have questions and you have an existing provider that is on your team and you haven't mentioned it before, to think about what may be impacting that, but you don't have to go into detail about what your experience was. But if it's something you want to mention to your provider, that you can, and have them help you work towards figuring out what direction you want to move in, like regarding talking about this experience and addressing this experience. And so please know we are here to help you. Your story and your experience matters, that recovery is possible, and we treat many veterans at different stages in treatment to help them work on their goals. We also collaborate a lot Dr. Karen talked about this earlier, with complementary care. So we, in some facilities, we work with recreation therapy. We may work with occupational therapist. We may also work with chaplain services because there may be times that some veterans may not be ready to talk in detail about what has happened or to specifically address their trauma. And so getting engaged with some of the complementary care, and it can help get people more ready to process the strong emotions and to process talking in detail about these experiences. If you ever have any questions, please don't hesitate to reach any of us as MST coordinators. And also feeling free to talk to your primary care provider or your existing mental health clinicians. So thank you again for having me today. And if there's any way that we can be helpful, please let us know.
Thank you, Miss Lewis, for that presentation. Our next speaker is going to be covering the topic of pelvic floor rehabilitation, and that is going to be Dr. Kayla Thompson. Dr. Thompson attended Shenandoah University in Winchester, Virginia, where she graduated in 3 years with a BS in biology and religious studies. She went on to then complete her graduate coursework at Shenandoah University School of Health Professions and graduated in 2018 with a doctorate in physical therapy. Her clinical experiences were focused around pelvic floor and neurological rehabilitation. After graduating, Dr. Thompson took a position with Central VA Healthcare System, where she helped to establish a pelvic floor physical therapy program. Her focus is providing comprehensive care to male and female veterans with pelvic floor dysfunction in areas of expertise including sexual trauma assault survivors, sexual dysfunction, and pelvic floor neurological disorders. She has extensive pelvic floor training, including Herman and Wallace Pelvic Academy, providing care for the pregnant patient, prostate cancer survivorship, sexuality training, and she's certified in Parkinson's bladder management, as well as a certificate in adult and geriatric incontinence rehabilitation. Excuse me, Dr. Thompson has special interest in survivors of military sexual trauma, and she is also a board certified clinical sexologist. Please join me in welcoming Dr. Kayla Thompson.
Hello, thank you for that welcome. So I get to talk a little bit about my favorite subject ever, which would make sense since I do this for a living. So we're going to talk a little bit about pelvic floor physical therapy, what it is, how do you access services, do you need pelvic floor PT, how do you know if you need it, who do you go to? We're just going to cover kind of all the nuts and bolts. So I like to start with what is pelvic floor physical therapy. I get people come into my office all the time and go, "You're a physical therapist and you do what?" So we eval and treat various disorders related to the dysfunction of the muscles, bones, ligaments, tendons of the hip, SI, sacroiliac joint, and pelvic floor. Now, this includes all things within the genitals. So bladder, bowel, sexual dysfunction, anything in that realm is going to be something that we handle. So we're going to talk about some very specific things, some that you're going to feel like is TMI, but as I always joke, there's no such thing as TMI in my office. I've heard just about everything, and we're here to help you. So if we don't know the problem, we can't help you. So we'll talk kind of more specifics, but next slide, please. So what's the pelvic floor? What am I even talking about? So the bony pelvis is what makes up kind of where you think your hips and your waist are. They're what you sit on. Now, at the bottom of our pelvis is no bones, because if there were, we would have to break a bone to have a baby. And as women here, we all know that would not be super fun. So we have only muscle, ligaments, and tendons down there at the bottom of our pelvis. They kind of make up the bowl of the pelvis, kind of like a hammock or a sling, holds up all of our internal organs, helps us to sit, breathe, walk, move, pee, poop, have sex, have babies, all of the important things in the world. Now, what people are most familiar with 9 out of 10 times is the word Kegels or Kegels, commonly called pelvic floor contractions. So this is a strengthening of those muscles in the bottom of your pelvis, and it helps to improve bladder bowel control. You also can have better orgasms. The better strength in these muscles, the better orgasms you will have. So that's often, highly motivating to do your homework because, physical therapists, we always give you homework. But that is not the only thing we do. So we will include things like stretching, down training if you have pelvic pain, if you have pain with intercourse, postpartum, you just had a hysterectomy, everything kind of hurts. Well, then we don't necessarily want to strengthen everything immediately. We're going to help you learn how to relax those muscles, get some more length out of them, feel a little bit better. Then if we need it, we can always talk about strengthening. And then manual release. So a big part of my job is sometimes doing vaginal exams, getting onto those muscles, helping teach your partner, teach your friend, whoever, how to release those muscles. There's lots of techniques to do that. There's lots of tools in the toolbox. We'll talk about in a moment on doing that. But these muscles are just like anything else. They feel rather intimate because of where they are. But if you think about going and getting a massage kind of for your shoulder, same general idea. They just happen to be living in a cave, so a little bit harder to access. Next slide, please. So let's cover a little bit what normal, big air quotes over normal, because I'm not sure anything's ever normal. So I tend to like the word average. So average bladder habits. So if any of these don't match your current life, it may be worthwhile to talk to your doc, to talk to a PT or a pelvic PT specifically, and kind of get into our office. So I'm just trying to give you kind of an overview. So the first thing is going to the bathroom every 2 to 4 hours-ish. Now that can obviously be, a little bit different. If you just drink a gallon of water, might go a little bit earlier. Really, 4 hours is the longest I want anyone pushing though. Leaking urine or bowels is never normal. Period. End of story. I don't care how many babies you've had. I don't care how many surgeries you've had. Leaking is not a normal experience, and it is something we can help with. There is a solution to that. And so don't just try and live with it. I've heard too many stories of women in particular leaking urine for the last 45 years because that's how old their youngest child is. And then they have a couple sessions and they're better. And so don't just live with it, right? There is help available. We want to help you get in to see us. Nocturia, this is getting up at night to go to the bathroom. So we don't want you getting up at all, really, ever, right? We want you to sleep. That's how we all feel better about everything, is good, healthy sleep. But ideally would be 0 if you're under 65 and no comorbidities. Now, what I mean by comorbidities is if you're on something like a diuretic, if you're currently pregnant, those, sure, 1 to 2, we could probably chat and see what's going on there. But really, we want 0 if possible. Now, over the age of 65, we start letting you have 1 to 2 bathroom trips a night. This is mostly because, like everything in the body, after the age of 65, things just stop stretching well. And because of that, the bladder is just a little bit smaller. So getting up at night can be more of a average or normal thing. So not necessarily something we can train out of you. Now, hydration. This is something that my patients look at me like I'm crazy for. I'm used to it. It's fine. So goal would be 1/2 ounce of water for every pound of body weight. So a 100-pound person should drink about 50 ounces of water. Now, you'll notice I use the word water and not fluid because ideally we would have you drinking actual water, right? Not soda, tea, coffee, juice, insert delicious thing here. Now, I love coffee. Glass of wine can be fabulous every now and then, but really we want y'all to focus on water, good consumption there. There's tons of caveats to that. There's tons of different kinds of water, right? But ultimately we want at least bare minimum more water than anything else. And then, of course, we want to increase that number with activity, with pregnancy. If you're breastfeeding, my goodness, increase that fluid intake if we need to. If your body's telling you you're thirsty, please increase it. But that's kind of the bare minimum that I'm looking for most people to hit. Next slide, please. Okay, so this is a really long list of things that pelvic PTs see. Now, this is certainly not all encompassing, but I tried to get the most common ones that we see, at least in my clinic with my pelvic PTs I work with and oversee, and then some of my other coworkers that I know are in the other VISN 6 locations. So dyspareunia is a big one. This is the fancy term for painful intercourse. Now, there's a lot of things within that realm, right? So there's lots of different diagnoses within sexual dysfunction, but just having sex hurts, we call that dyspareunia. Constipation. I see that one a lot too. That's something we can also help with. We can help you release the pelvic floor, learn how to go poop, because there is an actual mechanics to that, and kind of decrease that pressure, that Valsalva movement. We can help give you a healthier pelvic floor. Unspecified pelvic pain. This is male and female in my clinic. Obviously, I'm only talking to ladies here, but interstitial cystitis is painful bladder syndrome. So if your bladder hurts, it's actually physically in pain. That's one thing we see. Polycystic ovarian syndrome, PCOS, often comes with lots of other kind of comorbidities, other things, other pelvic floor problems. Endometriosis is a big one. And then, of course, a pelvic PT's bread and butter is incontinence. We've got fecal incontinence, so that would be bowels, leaking bowel fluid of any kind. Stress incontinence, which is your sneeze, cough, laugh incontinence. You have urge incontinence. That's, ooh, I got to go to the bathroom. Oh my gosh, I'm leaking on the way there. You have mixed, which is both. So you leak when you sneeze and you leak on the way there. And then I also see in my clinic, and I think all my coworkers see male and female and everything in between. Diastasis recti, so that's a split of the muscles in the abdomen, very common postpartum. A lot of women have heard of it. It's getting very trendy nowadays. The muscles kind of separate here, and you can actually feel that linea alba, that fascial lining in the middle, becomes wider, and your muscles aren't coming together. So you'll feel a little bit of doming when you go to sit up. You'll kind of feel like your organs are coming out, and you just don't have that core contraction, that strength. So that's certainly something we can help with, reestablish that strength, get those muscles to kind of knit back together is kind of the idea. Pregnancy. Now, obviously, this is huge. At least our VA, we follow our pregnant patients almost through their entirety of their pregnancy, and then even do a follow-up postpartum. So any pain, laxity in the hips or in the back, clogged milk ducts, we can actually do some things for that as well. There's good research backing that up. And then dysfunctional voiding. So that could be retaining urine when you're trying to go. That could be having a start-stop urine stream. There's a whole world here. And of course, this is not all encompassing. If you name it in the genitals, we've probably seen it, but I tried to hit the big points. Next slide, please. So I think this is the last thing I wanted to go over real quick, was just how do I know if I have pelvic floor dysfunction? So you just heard me talk for several minutes. Hey, this is a thing. Now, how do I decide if I need pelvic PT? Well, thankfully, there's this really fun little tool here. And I think the slides are going out to you guys, so you'll have access to this. But this is called the Pelvic Dysfunction Screening Protocol. Essentially, it's just a couple questions there. And if you answer yes to 3 or more of those, that would justify getting a consult to see a pelvic floor PT. So how do you see a pelvic floor PT? Let's say you get a yes, and you're like, oh man, I got to go see those crazy people that tell me how to do Kegels. So your first step is going to be going to your primary care, or really any physician. I get referrals from urologists, urogynecologists. I actually get them from mental health sometimes if we're talking sexual dysfunction work that's more body related. Really any provider that you're seeing can put in a consult for pelvic floor PT. We are just like every other physical therapist. We're probably located in the same spot as your back pain or knee pain or shoulder pain or elbow pain PT. So definitely get that referral, come and see us. A lot of us offer virtual visits if you live 300 years away. Community care is, of course, sometimes a thing if you actually live 300 years away. And virtual is hard to get to or is impossible for whatever reason. So definitely ask your doctor about it. We have lots of solutions to barriers, and we'd love to see you. So let me know if you need anything from me or my team, but I hope I get to see some of you all, and I hope I got to answer some of your questions about pelvic PT. Next slide.
Thank you so much, Dr. Thompson. I was writing down keywords like pressure, release, Kegels, and wine hydration, right? That's what you said. Wait, no, you didn't say wine hydration. You said hydration with water. Got it. I'm correcting my notes. All right. So now we're getting to the very interesting part of our program, which is to answer any questions that you may have about any of the presentations from our subject matter experts. Facilitating this is going to be Melissa Gilmore, who is our interim Women Veterans Program Manager. So any questions that you may have, you can either raise your hand or you can put your question in the chat. Now, remember, people, that if you hear this noise, if you're asking a question, it means that it may be getting a little long in duration and we need to shorten it because again, our clinicians do see patients in the morning, so we want to be respectful of their time. So if you have any questions, you can raise your hand, or as I stated, you can put them in the chat and Ms. Gilmore will address those questions accordingly. Dennis, we have a hand in the audience.
That's me. My name is Jamie. May I go ahead?
Yes, you may.
Yes. I'm sorry, I don't remember the presenter for the topic, but we were talking about mental health referrals. And so I noticed that what I literally just got told today, or I am recently in a process of 2 evolutions here, did not match up with what was presented tonight. So I wanted to kind of clarify. So in requesting mental health, I understood tonight that it could be done through Impact Team, my PCP. However, I requested mental health and got told my PCP is no longer able to refer to mental health. And then in the message back, I got a phone number to call. So I called that number and that person seemed almost just as lost at trying to get my referral in. So what is the proper method now? I'm in the Hampton, Virginia. In the VA, Hampton, Virginia. So what is the actual proper method?
I'm so sorry that happened to you. Even if something is not somebody's job or it's not their process, we want you to get accurate information about that. I am going to defer and see if maybe a Women Veteran Program Manager from Hampton could chime in here. And if not, we'll want to follow up with you and get you that information.
Okay.
Hi, good afternoon or evening. I'm Kathy McDonald. I would have to say that the primary care teams here have what we call it a PCMHI team assigned to each primary care provider, and they have immediate access to their primary care teams. And what I missed in the story is, I'm sorry, did you actually send a secure message to your primary care provider?
Yes.
And you were trying to get to a behavioral health intervention program?
I was just trying to get a therapist referral.
Yeah, I would have to take this offline with you so I could advocate for you better, because I would want to go into your records and see if I could help you get that connection. We do have new providers, and I'm sorry this happened to you. And maybe they just weren't aware on how to access their primary care mental health integrated team.
Okay.
Yeah, let me give you my number in the chat. It's also on the internet. But this will be the easiest way for you to reach
Okay.
me.
We also
There you
have
go.
another
There we go.
question in the chat from Sherry, Army
Thank you, Ms.
veteran here.
McDonald.
Go ahead. Okay. We're going to go with the question in the chat from Sherry. She said she was told that by an MP that she sees in Asheville, VA, that talk therapy is not available there. The presentation today indicates otherwise, which is true.
That's a fantastic question. I would also like to know that. I would defer to someone locally at Asheville. It would be very surprising. I would want you to make sure that you're getting that information from a mental health team. Sometimes our primary care teams don't have full awareness of what's available on mental health teams, but I'd be very surprised if some form of talk therapy is not available. Okay, it looks like you've now got a contact information in the chat to chat with Kim McDowell. Sherry, see if we can get that figured out.
I wanted to add how important it is to identify what you're wanting to work on. I think that really helps because as I know Dr. Karen talked about, like what are your goals? I think that really helps with the providers knowing how to refer you, and then also like what treatments are available. So that may help some in that case. And I'm sorry that you experienced confusion around that.
Any other questions that you would either like to come off mic for or enter into the chat?
One other thing that I will add about availability of mental health services is that there are facilities, Durham included, where we have wait times for things like individual therapy, or it takes time for scheduled appointments for psychiatry and things like that. At Durham, the way that we handle that is we offer folks to wait for that service or be referred to a community care partner. You know, if you're running into questions of what is available or not available, I think I would sort of refer back to what I was saying about what is evidence-based. And if there is a particular service that is evidence-based for your condition, so if you have major depressive disorder, for example, evidence-based psychotherapy is best practices for depression. And so it's medically indicated for you to receive therapy for depression. And that should be available to you. If it's not available in your facility, then I would hope that community care would be an option for you. I'm not at these other facilities, so I can't say how that's handled, but that's how we would handle that at Durham. That's another option. If you're hearing that something's not available, it might be a matter of wait times. And maybe you could also inquire about community care.
And I will also share that within this presentation, there's additional slides towards the end that shares specific services, women's health mental health services that are available at each facility. Because as it was shared earlier, every site may not offer the exact same thing, but there are some services that's offered at all of our VISN 6 facilities. So I encourage you to take a look at the slides that, again, each of you will receive. It will go to the email address that you provided for registration. And each facility does have information about specific services and also how to access some of those services. Thank you.
Thank you so much for that, Shanika. This is going to be the last call for any questions that may have just popped into your head that you want to have answered. You can, again, either come off mic or you can put it in the chat. If there are no other questions, then we will go ahead and wrap up this great, informative
I'm
session.
so sorry. I'm so
Yes,
sorry to cut
absolutely.
in. Hi, this is Marley Skinner, and I'm at the Central Virginia VA Healthcare System, which is in Richmond. I know that some of you may really have some burning questions and are perhaps uncomfortable coming on mic and asking them, or uncomfortable putting them in the chat. I would just want to implore and encourage you to please reach out to your WVPM, your Women Veterans Program Manager at your local facility, to ask those questions, because we don't want you walking away feeling like your question was unanswered or your need was not met by any of us here. So like they said, the slide decks will be available. Our contact information is within those slide decks. And again, I would just implore you to please don't be shy, reach out. We're happy to talk with you one-on-one. And I'm sorry, Candy, I'll turn it back over to you, and Army leads the way.
Army leads the way.
Yes, we'll give you that for now. Great, thank you. Thank you, Marlise. We're all in the same family. Greatly appreciate you sharing those comments. And I just want to say thank you to each of you who have who's taken the time out of your very busy schedules to share this an hour and a half with this evening. But I also want to personally thank each of our presenters this evening, because I know it's not easy to work a full day and then um, you give another hour and a half of your time, but greatly appreciate you. And more so than that, I know our women veterans definitely appreciate the information that was received, and I'm seeing and feeling the love through the chat. I just want to say thank you. And a special shout out to Dennis. He may be our only male on, but that's okay. He's a public affairs officer who has supported us for this event. And also just thank each and every one of our women's health team members that are here. And as Marlise shared, if you have any questions, please don't hesitate to reach out to your Women Veterans Program Manager at your facility. The information is here on the slide. In addition to that, yes, you will receive the slides emailed to you. And I just want to wish each and every one of you to have a very relaxing evening, and thank you, and looking forward to the next time. Now, the next event is scheduled for June the 23rd, which is a Tuesday, June 23rd, same time, 5 to 6:30. Now, the link will not be the same, so look out for information regarding registration for that event. But you can mark your calendars for June the 23rd. And thank you all, and we'll talk with you next time. And please don't hesitate to share this information with other women veterans. Bye-bye.
Happy Women's History Month. Good night, everyone.
Yes, thank you. Yes.